In this video, I will go over the infectious causes of otitis media, otitis externa, and malignant otitis externa, discuss their presentation and the treatment option. So if here is the structure of the ear, so you can see the middle ear shown in pink color, and then the external ear canal shown with the orange color. So patients with otitis media, there would be increased inflammation in this area, as a consequence of which it will cause bulging of a tympanic membrane, while patients with otitis externa will have inflammation in the external canal, and then they would present with pain upon touching the pinna of the ear. And then finally, patients with malignant otitis externa will present with the formation of the granulation tissue in the external ear canal, and it can also affect the skull bone. So here I would like to go over the infectious agents. So for both otitis externa and malignant otitis externa, Pseudomonas is the most common cause of these conditions, while with otitis media, Streptococcus pneumonia, Haemophilus influenza, and Varicella catarrhalis is the common causes of otitis media. Now for the presentation of the otitis media, I just explained for you why there would be bulging of a tympanic membrane, and then therefore there would be decreased mobility of the tympanic membrane. Patients with otitis externa will present with the swollen ear canal, as a consequence of which they would have a tender pinna and tragus of the ear. And then finally, patients with malignant otitis externa, which is commonly seen in diabetic mellitus patients. So that's very important. Patients with diabetic mellitus can develop malignant otitis externa, presents with the granulation tissue in the ear canal. Now for the treatment options, the mnemonic that I use to always remember what medications to use is from inside structure going outside. So first we have the inside structure, the middle ear, then we have the outside ear, and then finally we have the bone and the skull as the outermost structure. So the way I memorize it is that the innermost structure I use A, and the third structure I use C to begin with for the treatment. And then all of them have an X inside. So here, can you guess what medication is used for the treatment of otitis media? That would be amoxicillin. And then how about malignant otitis externa? The medication starts with C and has an X inside. So it's ciprofloxacin is used for the treatment of malignant otitis externa. And then for otitis externa, we also have an X, but then it doesn't start with P, so just be careful with that. So there is a polymyxin as well as neomycin that is used for the treatment of otitis externa. So let's go over that again. So for the innermost structure, start with A, has an X inside. So for otitis media, we use amoxicillin. For outermost infection, which is the malignant otitis externa, we start with C and has an X, so ciprofloxacin. And then for the middle one, which is the otitis externa, we use it has an X inside, so we use the polymyxin, and we also use neomycin for the treatment of these patients. And that concludes our discussion.